Okay, good evening, everyone. My name is Andrew Lay, and tonight I will be discussing how to combat neck and low back pain during lockdown. So I stole this picture off social media and I thought it was funny and pretty much sums up our situation here. So while the rest of Australia is um, living their normal lives, or at least relatively normal lives compared to us, we're sort of stuck inside um, for everything, whether it be work or our hobbies. And what this has meant is that not only are we missing out on things like sport and the like, but we're also missing out on incidental exercise. So even something as simple as walking to the train station or walking around our offices at our usual workplaces, we're not getting any of that at the moment. And the fact that we all have Zoom and Teams on our PCs and our phones is a testament to all that. Even aside from work, when it comes to our hobbies and other things in life, we're we're trying to limit how much we have to leave our house, and thus people are saying, how they're spending their time is with things like watching movies and playing video games and watching TV, and that's all well and good. But in the end, we're spending a lot more time more sedentary than we usually are. So just a little bit about me. I have 9 years experience in private practice physio, and I'm based at Melbourne Sports Physiotherapy in Blackburn. We also have clinics in Essendon and North Melbourne. I am an APA titled sports and exercise physiotherapist. From a sports coverage standpoint, I have spent time with the Ngunnawal Inspectors basketball team, both the men's and women's teams. So they're a semi-elite team, just under the NBL. In the league, that's just under the NBL. I've also spent some time with Melbourne United Basketball as part of my master's training, and I've also worked with amateur rugby union and Aussie rules teams in the past as well. In my 9 years, I've had 17,000 consultations, and I can say with confidence that a huge portion of those are related to neck and low back pain issues. Okay, so the aims for this session, firstly, to discuss the common factors in neck and low back pain. I'd like to give you some tips for preventing neck and low back pain, as well as briefly speak a little bit on management of these problems. I want to go through some of my exercises that I typically give people. Not all of the exercises in my repertoire, but some of the more common ones that I give. And also I'd like to go through some truths and myths regarding neck and low back pain. So, common factors for neck and low back pain. So the first one is sedentary lifestyle and / sedentary hobbies. So this one has this risk factor has skyrocketed, of course, since March, since Corona sort of took over here in Melbourne. And although I've seen a lot less contact sport injuries this year, of course, that's been replaced with seeing a lot of injuries due to directly related to being sedentary. Another common risk factor for injuries is sudden increased load. So an example for this for low back pain would be, let's say you seldom do the gardening at home. But now, because of all the time that we have, you decide that now is a great time to get on top of the garden, and you go from doing, say, your gardening once every couple of months to doing it once or twice a week, and therefore putting a sudden increase in demand or load through your low back. So that's just one example. One of the known risk factors for injury is, of course, prior injury. So the most well-known example is sprained ankles. So if you have sprained your ankle before, you're more likely to sprain your ankle again in the future, and you're actually more likely to sprain your ankle. You're more likely to sprain the other ankle, interestingly enough. So prior injury is a big risk factor for neck and low back pain also, and it's a common question that I ask people when they come in with their neck or low back pain issues is this an injury that is recurring? Another common risk factor is suboptimal technique or movement patterns. So an example of this might be, say, barbell squats in the gym. Maybe people have been performing their squats with a suboptimal technique and thereby putting more pressure on their back as opposed to a healthier technique. Pre-existing weakness is another big risk factor. Most of my patients who are familiar with me know that in the end, a lot of their issues can be traced back to perhaps a pre-existing weakness, and it's my job and the physio's job to determine what weaknesses exist and to get on top of those weaknesses so that people can move better. And finally, inadequate preparation. So in my time working, one of the typical stories that I hear is people hurting their low backs because they've literally woken up and the first thing that they've done is they've walked to their laundry and they're putting their laundry load into their front loader washing machine. And so they've gone from getting out of bed to repetitively bending and lifting their loads of laundry. And that's an example of inadequate preparation. So when it comes to prevention of neck and low back pain, the two most important things for me are firstly one's behaviours. So what we do and how we do those things, and also exercise and our general activity levels. I'd like to give you some of my favourite tips for good behaviours and habits in terms of the neck and low back. So my favourite one and the most important one is to avoid lengthy sitting periods. So often when we're working at our desk or maybe watching a movie or something like that, we're in the zone, we're focused, and sometimes it's easy to forget to get up, okay? But a lot of people who have jobs which are sedentary, if they're never getting up or if they're getting up very seldomly during the day, then eventually they stand a high chance of running into neck and low back problems which can be linked to their sedentary job. So my advice for people who have to sit a lot is to get up every 30 minutes. Of course, those of us who are working from home at the moment, consider a standing desk. So a standing desk is really useful for being able to stay productive but not sitting all the time, sorry. So you can, on the Officeworks website, there's a variety of different standing desks which you can get. if you're working off a laptop, elevate your screen so that you're not always looking down at the screen. Again, you can get something to sit your laptop on, and if you get an external keyboard or wireless keyboard and mouse, that would be useful, because if you're elevating your laptop on top of something, well, that means the keyboard of the laptop is also elevated. So rather than elevate the laptop and use the keyboard on the laptop, get a wireless mouse and keyboard, or even a normal wired mouse and keyboard, plug it into your laptop. You can get external keyboards and mice really cheaply from places like Officeworks and Target, etc. And the other things, be aware of your pelvic position. So in this basic diagram, the pelvis is this thing here. Now, you don't really have to know what the pelvis is, but I want you to think motion is lotion. And so if you can move your back by arching your back like that and then flattening your back, like the picture on the far right. And this way, even though you're sitting down, you're still moving your back. So that's something you can practice right now. And this is a really important piece of advice that I give to patients who have to drive a lot for work, or maybe they live really far from home. Sorry, maybe they work really far from home, or maybe they're truck drivers, or they work in delivery, and therefore they're in the car all the time. Flattening and arching your spine against the seat as you're sitting is a really easy way of getting that movement into your low back. So I often say, do some pelvic tilting when you're sitting at the traffic lights. Okay, so I'd like to go through some exercises that I typically give. So starting off with some basic things. So when it comes to the neck and posture, with long periods of sitting, these muscles on the side here get typically stiff and sore. We all experience it sometimes. So a couple of easy exercises which you can do is side bending, and you can hold that for 30 seconds. And you can do that for a few reps, and that'll help loosen those muscles on the sides. You can do shrugs. So a shrug is when you hike, you're using these muscles to hike your shoulders up towards your ears and then back down. I think it's important to practice trunk rotation as well in terms of our posture. If you think about the rounded shoulder posture, sitting position, really when it comes to rotating our trunk, it's the opposite of sitting rounded in terms of the way that our spine moves. So I'll just play this little video. So lying on your side and opening up your trunk like that. And I like this because not only are you getting that rotation into your spine, but you're also giving yourself a pec stretch, which is pec as in pec muscles, which are the ones that are at the front. So that's called the bow and arrow, and an exercise that I give quite regularly. And another common exercise that I give for posture and trunk rotation is threading the needle. So for this exercise, on your hands and knees, with the so-called needle being your arm, threading it through that gap between the other arm and your leg, and rotating like that. So some progressions of those exercises. So the bow and arrow and threading the needle can be simply progressed just by adding a band. So with the addition of a band, we've turned a mobility exercise into a mobility and strength exercise. In this case, you're strengthening the muscles which rotate the middle of your spine. And same with the thread the needle. Just doing the exact same thing, but with a band. Now this one on the right is more of a functional exercise. So when I say functional exercise, what I mean is an exercise in which you're practicing a movement which mimics or replicates a movement that we might do in our lives. So inevitably that involves using our legs as well. So it doesn't have to be a pulley. It can be with a TheraBand as well, but squatting or split squatting. And then as you come up, rowing the band or the pulley and rotating your trunk at the same time. Okay, now for the low back, there's 4 basic movements which the low back does. So the first one is rotation. So for this exercise, lying on your back and twisting your low back by just letting your knees or your legs fall from side to side. Okay. And you can go lower than she is. But that's a nice and easy way to practice rotation for your low back. For your flexion, this is the child's pose. So people who do yoga would be familiar with this and similar exercises where you're arching your back. And you can hold that position for 30 seconds and get and practice that flexion. For lumbar extension, so lying on your stomach, either on the floor or in bed, keeping your hips on the ground and arching your back. And finally, for side flexion, this exercise is called the mermaid because of the way that you're sitting. So reaching out to the side, aiming for a stretch in this flank area in there. Okay, and if you practice these 4 movements, it makes sure that your back is getting rotation and flexion and extension and side flexion. And it's important to practice all of them because in our lives, if we didn't do exercises like these, there's every chance that our backs aren't getting 1 or 2 of these movements. So the back is designed to move, and it's important that we practice movement. Otherwise, we get stiff and we bring ourselves to be a bit more injury prone. Some progressions for those exercises. So the mermaid, which you just saw, you can add in some trunk extension by doing it against an exercise ball. If you have one, you can use, say, a soccer ball or a basketball or something as well, but a fit ball or a Swiss ball is a bit more comfortable for that exercise. This exercise, physios, we call these the hundreds. In some ways, it's similar to a sit-up, except it's done with consideration of low back position and with control. Here, 4-point kneeling, donkey kick or kickback. And what you're doing there is you're arching your back as you kick up. And the pike, so similar to a diving pike, but with your legs on an exercise ball, using the ball and your muscles, of course, to bring your legs closer to you and then going back out. Some more functional exercises. So this is one of my favorite ones. It's the double leg squat to double arm row. So 2 movements. You squat and then you row. So you can make that heavier on the pulley, or you can hold the band tighter if you're using a band at home. And yeah, the first movement, you're squatting, and then second movement, as you're coming up from the squat, you row. So not only are you using the muscles at your back to help pull the resistance towards you, but you're also using your hip extensors or your glutes to help assist you in pulling that weight towards you. So it's a very functional exercise. And there's also a single leg version that I like to teach as a progression from the double version. So this time rowing from under my trunk towards my trunk. And you don't have to hold a weight on the other side. That's just there to make the squat a bit harder. But this is a more advanced exercise. So if you're not sure about that one, there are considerations regarding balance and technique that it will be to discuss, good to discuss with your physio. So what if you already have symptoms and you're not sure about what to do? Well, not only is the right exercises and behavior important, but the right treatment can be very helpful. So in terms of how I approach most new injuries or injuries that are new to me is, firstly, we go through a physical assessment, and then based on the assessment, I will trial a treatment and then reassess. So let's pretend for neck pain that you've got pain turning to the left. So based on the things that we've discussed and the things that I've seen on testing, I will then trial the treatment, and then I will reassess your turning to the left. And my question for you will be, well, A, do you have more movement? And usually that's pretty obvious because I can see if you are moving more. But B, do you have less pain doing it? And generally, if you have more movement, you have less pain because you don't have as much pain blocking the movement. So if that's the case, then I will continue repeating that same treatment. And if it didn't improve, well, what that means is I need to trial a different treatment in order to give you a better improvement. So that general system which I've described is not just for neck and low back. That's how I approach all patients and all injuries that they come in with. And of course, based on the assessment and your treatment, it's important that we give you the important specific advice and exercises which are good for you. And I'd really like to emphasize the fact that it's specific. Okay, so for example, if you have a low back issue, I'm just going to scroll back. If you have a low back issue for which it's painful to do an exercise like this, well, then my advice is going to be to not do that and to avoid or limit activities where you have to bend backwards or similar. So just be mindful that although these are really good in terms of self-maintenance and self-prevention of issues, if you have an active neck or low back issue, you might want to be careful with the actual movements that you're doing, because some of them can be counterproductive until, of course, you get over your current injury. So, in terms of treatment, what might we do for you? So, spinal joint mobilizations are really good for loosening up joints if there's a strong joint component to your injury. Massage is really helpful. Not every patient needs massage, but certainly if somebody has a really strong muscular component to their injury or their symptoms, then massage can play a really useful part in them feeling better. Dry needling is useful for getting rid of tight spots, which might be deep within a muscle. Again, not everyone needs dry needling, but for those who I think would benefit from dry needling, then I will have that discussion with them in terms of that it will be effective for them and it's worth doing. But I could have days where I don't needle at all and days where I'm needling all day long. So it really depends on what I see in front of me. We've already discussed the importance of specific exercises based on what we see in terms of your symptoms and how you go during assessment. Specific advice regarding good / counterproductive activities or behaviours. I know, and physios know, that you have a life to get on with, you have things to do, and you can't totally avoid every single thing that might be painful. So we try to strike that balance between keeping you productive, but also not flaring up your pain too much. Medication, I'm certainly not anti-medication. However, if people have pain and they're looking for something aside from exercises and things like heat packs and warm showers and things like that, I will say, look, you know, if you need to be at work, let's say if it's a builder and they need to be at work and they need to do repetitive lifting and you need medication to get through because you can't take time off work, well, so be it. Of course, activity modification, which we've spoken about already, and clinical Pilates. So Melbourne Sports Physio in Essendon run clinical Pilates exercises, and they can be a really, really important adjunct and useful adjunct for neck and low back issues. There are patients who have been doing it for months and years because they really enjoy it. They enjoy having the supervision and the trust that comes with that in terms of knowing that they're doing the exercises that are good for them. The big difference between clinical Pilates and normal Pilates, say in a gym studio type of environment, is that clinical Pilates involves an assessment and a specific prescription of exercises, rather than a gym environment where 20 people rock up and they lie on mats and they're all doing the same exercises, which isn't appropriate. I mean, what if one of those 20 people are pregnant, for example, or one of those 20 people have an active low back pain issue? It doesn't really make sense for all 20 of those people to be doing the exact same thing. So my advice for people when it comes to Pilates, if they're interested, is always to seek clinical Pilates rather than a standard Pilates at the local gym. So let's go through some truths and myths regarding neck and low back pain, because there's a lot of them out there. So the first one is that you need a scan. So by scan, we're talking about X-rays, CT scans, MRI scans. And this is a myth. So you don't need a scan in most cases. So in most cases, imaging doesn't dictate the treatment or the management, most cases. The knowledge of whether there's an active disc problem or a joint problem usually doesn't matter, okay? I put an asterisk next to that, of course, because in some cases where we might be, where I might be or a physio might be concerned about a possible sinister problem like a bone stress fracture or something like that. In those situations where something a bit more serious is going on, a scan can be very, very helpful. And in those cases, I won't hesitate to send people, refer people for a scan. But for most cases of neck and low back pain, imaging isn't needed and doesn't add any value to the management. Okay, number 2, there is no perfect sitting position. So this is true. So it's not really feasible to maintain any single sitting position for long periods. You're better off getting up regularly rather than focusing on the perfect screen height for your computer or the perfect sitting position or anything like that. And so I'd like to point back to this picture from before in terms of arching your back and flattening your back against your seat as a way to get low back movement whilst you're sitting. Okay, number 3, pain means that you mustn't do that thing or that the injury is getting worse. So this is a myth. Pain, I spend a lot of time talking about pain with people because it's something that we all experience, but something we know very little about. So pain ultimately is a warning. The more pain you have, the bigger the warning. So we all have lives and activities to get on with. Because we can't just stop life just because of a neck and low back issue. We can't stay in bed all day. And so I like to describe my traffic light system with people. And so what this says is that if you are doing an activity and if you have 0 to 3 out of 10 pain, that's pretty mild pain, of course. And in my opinion, it's generally safe to continue that activity. Of course, listen to your back or your neck in case your pain goes from a 0 to 3 to a higher level. But as long as it stays in that zone, I'm generally happy for people to continue doing whatever that is, whatever that thing is, as long as it doesn't escalate. Now, if it does escalate into, say, a 4 to 6 out of 10 type of pain, that's an amber light or an orange light, which most of us would consider moderate pain. And I like to tell people, continue if you really, really must. So let's say you're doing a 10K fun run and you're at the 9.5 kilometer and you've got low back pain and it's a 5 out of 10 pain. Well, look, you've got half a kilometer left. Just keep going. Just continue. Okay. But if it's an activity that can wait or isn't necessary, or maybe someone else in the house can do it instead of you, it's better off that you don't do it. Of course, if you're getting 7 to 10 out of 10 pain, that's severe pain, stop the activity. It's likely that your performance in whatever that activity is quite poor anyway. And yeah, that sort of pain is counterproductive. Number 4, my back or neck is out or needs to be clicked into place or needs to be realigned, or my disc needs to be pushed back in. So this is a myth as well. I know that to an extent this is a language thing. You know, maybe you've heard that from a previous clinician that you may have seen in the past. Um, to an extent, it's semantics, but I also believe that this sort of language tends to end in an over-reliance in treatment. And there's nothing wrong with treatment. The right treatment is very, very useful when you have symptoms. People want to come into physio and walk out feeling better. But with language such as these, it tends to lead to treatments like this, where people are talked into needing, say, their neck clipped. This maneuver is a very risky maneuver. The actual the amount of people that get injured during such maneuvers is low, but the problems are potentially disastrous and permanent if you are one of those unlucky ones who get your neck cracked, so to speak, because you've been told that your joints are so-called out of alignment. Because your neck or back isn't out, and it doesn't need to be clicked into place. Nothing's dislocated, nothing needs to be realigned, and your disc can't be pushed back in. And treatments like this as well, some of you probably don't know what this is, and that's a good thing. Physios don't use it, but it basically it's a little clicky tool which is used to help so-called click joints back in. And whilst neck manipulation or having your neck cracked at least can help somebody get more movement, this literally does nothing. So I'm very anti these things. This does nothing, and this is not worth the risk. You can have treatments which have no risk and can achieve much better outcomes in terms of pain relief. And in the end, it's all about the control of your spine during movement, or in other words, exercises, rather than an over-reliance on, say, having something so-called clicked back in. Okay, number 5, stretches. So this is not so much a truth or a myth. It's more that you need more than mobility. You need strength and stretchability as we move or even sit. So for the head, our heads are around about 5 kilos. So if you're sitting for a long time, that's 5 kilos that your neck muscles have to hold. So it's important that we're strong enough to hold it. And so if you combine getting up regularly as well as being stronger, well, then we are going to be much able to tolerate sitting. Number 6, absence of pain means that there's an absence of a problem. So this is a myth as well. So I've had countless times where people have come in for the first time and they've said, I've got low back pain, and I first had it 5 months ago and sort of went away after 5 days, and now I've got the same pain again. Well, there's every chance that the problem never went away. The pain might have gone away for a period of time, but the lack of strength and lack of joint mobility probably was there the whole time. So it's important to understand that if you have pain and it simply goes away, if you've done nothing for it, it doesn't mean that there's no problem per se, that there might be other risk factors still sitting there, meaning that it's only a matter of time before your symptoms return. And finally, number 7, medication will fix the problem. So this is a myth, and most of us know that pain will or may help to reduce our pain and our symptoms, but it's not going to improve our spinal mobility and strength. So if you need to take medication to help you get through an activity or maybe work because you can't get out of it, so be it. Take medication for a short time to help get you through. But ultimately, you'll need to work on your mobility and strength. So thank you to everyone for tuning in. Everyone is welcome to email me on andrew@melbournesportsphysiotherapy.com.au. Please visit our website at melbournesportsphysiotherapy.com.au, especially our blog section, which has great info about anything and everything. So not just neck and low back issues, but also, for example, knee, hip, wrists. So yeah, we update that regularly, and we also are very active on social media. So with Facebook and Instagram, as another method for which we provide free education for people. Thanks very much.